There are a few tests that when you find out the result, they can actually save your life. Yes, we are focusing on heart disease. Yes, heart disease is the #1 killer in the United States today. But yet, we always think that it's somebody else that's going to have that. And it's never us, even though we may have a strong family history. So I want to thank you for taking the test. You know, it's a $300 test, but yet I think it saved your life. We have saved many lives with just doing the simple blood test to give us more information about a person's cardiac life. So tell us about your story.
I was 18. My dad had a massive heart attack right in front of me. And when I walked in the room, they said they had no pulse. He was,
oh my gosh.
That was it. And so I was at the end of the bed and I was looking at the firemen who were trying to save his life, and they brought him back. He went to the hospital, right? He got through that. But then he had a second heart attack. And I'll never forget that either, because he had to have a 6-way bypass.
Oh my gosh.
And when you go through that, I'm sure you know, when you walk into the room, you're on a machine and
That's right.
there are, cords everywhere and you're bloated, and it's really horrifying for a kid to see all that.
Absolutely.
And then recently I got a text message from a group of family members who somebody must have had this test, because they said, hey, everybody, you should go have this test. It's lipoprotein a. It's a genetic factor. You should really see, because you could have a heart attack or stroke. So all I saw was heart attack or stroke. And then I came to Longevity Medical Clinic. I got the Cleveland Heart Lab test, and I, in fact, had it. So my response was, guess what? I have the gene.
Yeah.
And so having a stroke when you're a single woman with no kids, and you think about what's going to happen to you if that does happen, and knowing that heart disease contributes to that, and knowing I have several of these risk factors, is really terrifying. So being able to have that information to change my life is really important.
Right. No, I'll say to you, I agree, it is terrifying, but at the same time, it's a call to action. And there is more that you can do to protect yourself today than ever before.
When I thought about cardiac health, I always think about LDL, HDL, and cholesterol. But when you sat down with me and reviewed my blood work, and I saw red in certain sections that I'd never heard about, it's completely changed how I see my health.
You've seen your dad have a heart attack right in front of you, yet you never thought that you were at risk.
No.
And then the other thing is, when you measured your labs previously, all you looked at was total cholesterol, triglycerides, LDL, and HDL levels. Well, that's not the whole picture, though. That really gives us very little idea about your personal risk. So we use Cleveland Heart Lab, and we've personalized the lab for our purposes by adding more things to the test so that we can go into more depth. So not only did we look at inflammation markers in the lining of the blood vessels, we looked at your basic lipid profile, we looked at inflammation markers for you, we looked at particle sizes, both for the LDL and the HDL and VLDL. We looked at apolipoproteins, we looked at the genetic risk, which is lipoprotein particle A, and finally, omega factors, how much omega-3s, which are protective, versus omega-6, which is a saturated fat, and what was your level, and then how would we manage it. So that whole panel is personalized to Longevity Medical Clinic by the Cleveland Heart Lab.
Can you tell me about the lipoprotein a? Because I think that was the genetic factor that I had no idea that existed.
Yes. Lipoprotein particle A is a genetic trait. It is basically a tail that is attached to the LDL particle that has an ApoB on it, which makes it so specific, and the fact that it's carried by the LP particle A gene. Now, the point about this is that globally, 1 in 5 people will have this. So the percentage is very high globally, and in the United States, 63 million people are affected by this as per the American Heart Association. And this LP little a particle is more atherogenic. What that means is all LDL particles aren't the same. They come in different sizes. The larger sized LDL particles are considered to be safe. The smaller ones are more atherogenic. So the higher amount of small LDL particles you have, the higher risk you have for developing atherogenic disease. And this lipoprotein particle A increases your risk for atherogenic disease, meaning it'll increase your risk for making a plaque. And when you build up plaque in the bottom of the endothelial lining and you constrict the blood vessel, now you're blocking blood flow. And you are at a genetic risk for doing this faster and more dangerously than other people are that may not have this risk factor. And what happens when you block off blood flow is either you get a heart attack or you get a stroke. Because eventually the blood vessel will be blocked and you will not be able to get blood flow. If it starts happening to the smallest of the blood vessels, then you get microvascular disease. If it happens in the brain, it causes dementia. But when it happens in the large blood vessels of the heart, it causes a massive heart attack like your dad had on a couple of occasions.
And that's pretty scary, right? Like looking at that, I think, when you told me about the large blood cells versus the small blood cells, immediately I asked you, what do you do about that? What do you do about the genetic factor?
Yes, we cannot change the genes that you were born with, right? We cannot, with a medication, lower lipoprotein particle A today because the drugs are not available right now. But there is still more that you can do, even with this risk profile, than not do, to protect your heart health and therefore to improve health span in lifespan.
You know, it's funny because when I heard you talk about all this, then you recommended a calcium test.
Yes.
And that's coming up.
Yes.
So that test would never have happened had I not had the Cleveland Heart Lab test.
True.
Which to me is, I'm excited in one breath and I'm totally terrified in the other because I don't know how much calcium buildup I have.
Yeah, the calcium score that you're talking about is actually a very quick CT scan. It literally takes a few minutes in the scanner, and what the scanner is looking for is the vascular supply to the heart and to see how many of those blood vessels have old calcified plaque in them. It's not going to tell us about new ongoing plaque formation, but once we have an idea of where you're at, then we can help you in risk stratification and planning and getting your other lifestyle factors going so that you reduce your risk of having a heart attack.
And what are those things when you say lifestyle factors?
Yeah.
I'm guessing part of that is exercise, which I'm not a total fan of. So
exercise improves the vascular tree. It builds collateral circulations for you. So if one area is blocked, there's another way to get blood flow to that same area. So exercise improves cardiovascular health. So you're not doing it for weight management or that. It helps with that too, but you're doing it because you're improving your vascular health overall. And muscle is the currency of aging. As we all get older, we have a tendency to lose muscle mass, and sarcopenia is real. It happens in old people. Then we become weaker and more frail and are at a higher risk of falling, breaking something, and then becoming bedridden.
Right. Well, I'm extremely grateful that this test is available. With this information, really, Longevity Medical Clinic can save my life.
Indeed, it can. And another message for women today is that you may not think you're at risk for heart disease, and I said that earlier on, but postmenopausal women are at a very high risk for developing heart disease. And it didn't start as you became postmenopausal. It's been accumulating, and now your risk is increasing because you do not have the protection of estrogen as you become postmenopausal.
What about the LDL size? Like, what can I do about that now?
I started saying that, so thank you for bringing me back to it. I have a patient in her 90s that carries this gene that is living a very healthy and fulfilling life even in her 90s. And to me, that is a very inspiring story because even though she had the genetic predisposition, She chose to do everything else possible to lower her risk. Now, you can start with exercise, you can lower your inflammation, you can lower your insulin resistance, you can lower your metabolic risk. If you have hypertension, you can manage your hypertension, and you can improve your sleep quality, reduce your stress load. So there's so many things you can do to lower that total risk of a heart event, even though you carry a genetic trait that is increasing your risk.
Well, thanks for offering the test. Thanks for explaining it to me. I'm looking forward to getting the calcium test and really being able to start the process of becoming healthier so that when those numbers go from red to green, I'll be like, Longevity Medical Clinic, thank you very much.
Here's to a better future.